Maharashtra and also in Mumbai. Asawari.
All right, okay. Stay on with us. More breaking news coming in where Health Minister JP Nadda has reassured the public that health authorities are keeping a close watch on the situation. He has shared that the World Health Organization has acknowledged the situation and its reports will be shared very soon. The reports, and in fact, the government has also held a joint monitoring meeting chaired by the Director General of Health Services to review the current situation and ensure readiness for any emerging health challenges. That's, of course, the latest that we are tracking at this point of time. Manohar Kestri on the broadcast with me. Manohar, finally, WHO has taken cognizance of the fact that HMPV is spreading and there is, this virus that we have to be careful and cautious of. If you could take our viewers to what it is that we know so far.
देखिए, जब तेजी से HMPV वायरस फैला और भारत में कल जब मामलों की पुष्टि होनी शुरू हो गई, तो केंद्रीय स्वास्थ्य मंत्री जेपी नड्डा ने बात को माना है कि चिंता करने की कोई जरूरत नहीं है, पैनिक लोग ना हो। और उन्होंने कहा कि WHO इस मामले को लेकर के संज्ञान लिया है और जल्द ही चीन और उसके आसपास के कंट्रीज में जहां पर ये सारे मामले फैले हैं, उनकी रिपोर्ट जो है तो भारत के साथ साझा करेंगे। सबसे बड़ी बात है कि जेपी नड्डा ने कहा है कि जो कमेटी बनाई गई है ग्रुप ऑफ ऑफिसर्स की या ग्रुप ऑफ एजेंसियों की, उनमें डॉक्टर अतुल गोयल जो डायरेक्टर जनरल हेल्थ सर्विसेज ऑफ यूनियन हेल्थ मिनिस्ट्री के हैं, उनकी अध्यक्षता में बनाई गई है। उन्होंने भी इसे लेकर के रिव्यू बैठक की है और कल जब हेल्थ सेक्रेटरी ने बैठक की है तो उसे लेकर के उन्होंने कहा कि हम जो है तो हर एक परिस्थितियों को लेकर के जो है तो लड़ने के लिए तैयार हैं, हम सक्षम हैं और सभी राज्यों को इस बारे में बता दिया गया है। जी
मनोहर, ये भी बताइए हमको एट दिस पॉइंट ऑफ टाइम कि जो हमारे केसेस रिपोर्ट हुए हैं अक्रॉस द कंट्री, what kind of treatment are they getting at this point of time? There are infants also who are in fact who've been tested positive for HMPV. What is the kind of health care that they are being given at this point of time?
देखिए, अगर हम HMPV के ट्रीटमेंट की अगर बात करें तो इस का कोई पर्टिकुलर ट्रीटमेंट नहीं है। जो भी ट्रीटमेंट है वो सपोर्टिव ट्रीटमेंट है। तो ऐसे में प्रिकॉशंस की मेन है। अगर हॉस्पिटल में पेशेंट भर्ती होते हैं, तो अगर आप कर्नाटका की बात करें तो आप देखिए ब्रोंको न्यूमोनिया, तो ब्रोंको न्यूमोनिया से रिलेटेड जो मेडिसिन है वो उनको दी गई है क्योंकि रेस्पिरेटरी ट्रैक्ट को इन्फेक्ट करता है। तो ऐसी स्थिति में उनसे सपोर्टिव जो दवाइयाँ होती है वो दी जाती है और साथ ही साथ सबसे ज्यादा ध्यान रखा जाता है प्रिकॉशंस को लेकर के, ऐसी और किसी और को इन्फेक्ट ना करे, क्योंकि ये एवियन इन्फेक्टर भी है। जब 2001 में हुआ था तो उसके साथ जब एनालिसिस और रिसर्च हुई थी तो उसमें इस बात की जानकारी मिली थी कि एवियन इन्फेक्शन भी हो सकता है, उससे सपोर्टेड है ह्यूमन मेटान्यूमोना। तो ऐसी स्थिति में जो है तो सारी एक गाइडलाइंस है, ट्रीटमेंट की भी गाइडलाइंस है, एडमिट करने की भी गाइडलाइंस है और साथ ही साथ जो वार्ड है या फिर जो उसके आईसीयू है उनमें किस तरह के पैरामीटर्स हो, मेन पावर्स को किस तरह से तैयार होकर के रहना। हमने कोविड में भी देखा था किस तरह से पीपीई किट लिया गया था, खास करके हेल्थ वर्कर्स को, वो वहां पर किस तरह से रहते हैं, उनको ट्रेनिंग भी दी गई थी। तो सारी चीजें बता दी गई है तमाम हॉस्पिटल एडमिनिस्ट्रेशन को, स्टेट गवर्नमेंट्स को भी कि आप किस तरह से तैयारी करें अगर मामले बने। कारण तो भारत के लिए चिंता की इसलिए बात नहीं है कि लगातार तमाम लोग चिंता कर रहे हैं, तो भारत में पहले भी इस तरह के केसेस रहे हैं। 2005 से लेकर के 2007 की बात करें तो 500 से 600 केसेस हैं। एम्स ने अपनी स्टडी में भी ये एनालिसिस किया है।
Absolutely, absolutely. Manohar, stay on with us. Joining us at this point of time is Dr. Ishwar Gilada, health expert. So thank you so much for taking our time and speaking to us on Newsx. I'm going to simultaneously request my crew to quickly open our call-in lines in case they have any queries and questions that they would like to raise with our doctor over here. Sir, again, there are cases that are now being reported in Maharashtra. There was a case that was reported in Gujarat as well. What are the kind of precautions that one must take? So I'm going to request you to unmute yourself, please.
Yeah, already unmuted, yeah. No, currently we do not need any additional precaution. we do not need to panic. What is happening is, on one hand, we create a scare among people, and then we say, do not panic. And that's what is the situation currently in the country, from all the states, from central government to all the state government. This virus has been in existence for 50, 60 years, has been identified in 2001, 24 years have gone. If you check any children below years of, age 2, for the presence of this virus, metapneumovirus, you'll find 4 to 5% of the children will be positive. And same with the study done which was in Gorakhpur last year in 2024. They found that 4% of the children were already positive with this virus. So under this situation, the virus number 1, which is a very mild virus, doesn't create any kind of panic, it doesn't create any kind of sickness, which will take you to hospital, get hospitalized, put on oxygen. We don't need that. Secondly, there is no vaccine to prevent this. Once you have suffered, the subsequent attack will be much, much milder. Couple of attacks, you will not be having this kind of infection at all. So my advice to the government and to the people is that do not panic. These cases will keep on coming, just numbering 8, 9, 10, this state, that state. It is not going to serve any purpose. Any village, any taluka, any district, there will be cases of this virus. They are already in existence. Secondly, we should keep on working to find out a vaccine, if at all. Currently, there is no vaccine. And number 3, the test for this virus is very expensive. So it is part of the multiplex PCR, which costs around 17 to 20,000 per test. Now, a simple example is when you do hemoglobin, it may cost 100 rupees. But when you do body profile with 100 tests, it will cost 2,000, 3,000 rupees. So that way multiplex PCR will diagnose. But what are you going to do? Because there is no perfect antiviral for this. There is no preventive vaccine for this. So therefore, we medical community ignore. Patient will come within 2 to 3 days will be okay. By the time the report comes, the patient is already discharged from hospital. So what we need to do, those people where the immunity is not made, for example, children below 1 or 2 years of age, or for those people which are having a waning immunity, they are above 65 or so, or those people with some comorbid conditions, organ transplant, uncontrolled diabetes, for them we need to take precaution. And for them, whether it is a virus, B virus, C virus, for any virus, any bacteria, we need to take precaution. What simple things are required is namaste, don't shake hands. Use sanitizer or soap water, sanitization, not sanitizer, because sanitizer, the moment you say sanitizer, cost increases. And thirdly, maintain a social distance. Use mask when you find some kind of such outbreak anywhere. I think only these are the things required. Nothing more is required. Just because the name China or Pakistan gets attached, it becomes a very big problem. ये एक कहावत है कि दूध से मुंह जला आदमी छाछ फूंक के पीता है. Yes, that is the situation, but it is not going to create any havoc anywhere in the world.
Right, sir, absolutely. Thank you so much for sharing all those details with us. Again, you know, what the doctor has just said right now, ladies and gentlemen, is that you don't need to be panicked about the situation that is currently underway. It's not something that is hazardous by nature. And again, you know, that's again the perspective that we have over here with us at this point of time. I'd like to thank you for joining us and sharing your perspectives with us. On that note, we're going to slip into a very short break. Thanks for watching.